Good morning, Jean.
Morning, Charmaine.
We were going to talk about blood glucose today, sugar.
We were indeed.
Mm-hmm. Um, I,
Something we all love.
yeah, actually, it is incredibly addictive. Um, and actually, this is a good, I'm going to share my screen because this is one of the slides from our brain health workshop. But this was published in the British Medical Journal in 2005.
Mhm.
Sugar
Yeah.
is as dangerous as tobacco and should be classified as a hard drug, for it is harmful and addictive. Think about that for a second.
And I would actually even take dispute with that and say, as dangerous as tobacco, I would say it's more dangerous than tobacco, because to take tobacco, you make a choice. Am I going to smoke or am I not going to smoke? Whereas sugar, however, is added into a lot of our foods without most people's knowledge. A tin of
Mm,
beans has got sugar in it.
mm.
And so it's actually worse because it's insidious.
Interesting. And also, it's completely normalized, right? If you gave your 6-year-old a pack of cigarettes, uh, you would probably be classed as,
Bad mummy.
exactly. But give yourself your 6-year-old a load of sugary drinks and things, and it's completely normal.
Mhm. Absolutely. And from our point of view, it was interesting just looking at the statistics.
Mm,
The end result of an overconsumption of sugar, and we want to qualify the difference between sugar and carbohydrate,
mm.
is the fact that the Office for National Statistics in February 2024 said that there are over 1 million adults at this moment in time living in the UK with undiagnosed type 2 diabetes,
So these are just the undiagnosed ones.
diagnosed ones.
Mm.
Um,
And if we talk a little bit about how that diagnosis happens, so what, from the NHS perspective, for you to get a diagnosis of diabetes, what would that entail?
Well, they look at a measure called an HbA1c, which is looking at a kind of average blood glucose level over a 3-month period. So that kind of averages out your levels, your blood glucose levels. The difficulty with that is that it's an average. So if you think about it, it becomes an average because you have peaks and you have troughs. So you could be cycling with high sugar, low sugar, high sugar, low sugar, and still look healthy in the middle. And the difficulty with that is that that's increased recently. It used to be that if you got to 42 of an HbA1c, then you were considered pre-diabetic.
Mm,
Um, they're now, some of the measurements I've seen, they're allowing you up to 46 before you're not even considered pre-diabetic at that point. At that point, they're saying you want to be watching your blood glucose levels.
mm,
But they don't actually say you are now pre-diabetic. The ranges are getting higher and higher and higher,
mm,
simply because I think the NHS can't afford to treat everyone.
mm. Yeah, it's interesting because what we know is that damage to the blood vessels and to the nerves happen, in that pre-diabetic state. So long before people are given a diagnosis of diabetes. So in that state, years. So I think the research shows 10 to 15 years before the diabetes diagnosis is made. In that period where the blood glucose is difficult to regulate, a lot of that damage happens to the vascular system and the nerves. Now, the reason why that's important, because we're talking brain health, and the brain is a vascular organ. It needs a huge amount of blood flow. So if the blood vessels are damaged, and the nerves inside the brain are damaged, we do see quite an extensive amount of damage to the brain. And that's why Alzheimer's is sometimes referred to as diabetes type 3.
Mhm. Yep.
It's a blood sugar, the body's inability to control blood sugar, which affects the brain.
And that's why it's very easy to see. You know, you can almost see the symptoms. If anybody's listening that finds it difficult regulating their blood sugar levels, that get hypos or hypers, you'll know that one of the first symptoms of a hypo, so when you're getting really low blood glucose levels because you're dysregulated, is you can't think straight. You get brain fog instantly. It's like the brain's starved. And it's, I think the thing that we seem to be almost waiting on the disease happening before we do something about it. And I know that one of the tests that we do that can give you a real predictor is we test fasting insulin levels. So insulin is the hormone that regulates your blood glucose level, and that will always bring your blood level to a healthy state, because the body recognizes that high glucose is damaging, so it will automatically pump it down. And the more it has to do that, the harder it has to work. So you will see someone's insulin levels begin to rise gradually. And when they're getting to like 8, 9, 10, 11, 12, depends on your measuring scales. But when your insulin levels are getting up above 8, 9, 10, 11, you know at that point that your body is struggling to control your blood glucose level. And so a simple test like a fasting insulin, which is cheap to do, will give you an even earlier predictor of whether or not you're likely to be developing type 2
About a
diabetes.
decade earlier than
Yep.
you're going to pick it up in the HbA1c or
So I've been doing lots of blood tests recently with patients, and I would say there's very few of my patients that I've done tests on whose insulin levels are optimal. Very few.
I think it's because you said that there is so much sugar in our foods. I know in my practice as well, when I ask patients about sugar consumption, most of them will say, "Oh, I don't really eat sugar." But when we ask them to keep a diet diary and we look through what they are eating, for instance, you're having cereal for breakfast or toast for breakfast. Now, remember that a lot of these carbohydrates actually turn into sugar. So although they're not, you wouldn't think of them necessarily as sugar. They immediately turn into sugar. And then maybe having a sandwich for lunch, and maybe a bag of crisps, potato carbs, and in the evening, some pasta. Or potatoes or something. So a lot of people don't realize how much carbohydrates or glucose they are consuming until we actually start putting that into a journal and measuring.
And I think the thing, diabetes used to be called stocking and glove syndrome. That was the old-fashioned name for it, because what it does is it destroys the small micro blood vessels in the fingers and the feet. But it damages. You end up with a neuropathy, so a lack of sensation, lack of blood supply to the fingers and the feet, which is why people with type 2 diabetes that's uncontrolled end up with with bad ulcers in their legs and in their feet, and wounds that don't heal. But it also destroys the blood vessels behind the eyes and in the kidneys. And of course, the kidneys are critical for detoxification and for maintaining your blood pressure, and so you get this never-ending link between a simple thing like what you're eating and high blood pressure.
It's true. Yeah.
So everything's connected, and we really need to remember to join the body back up again. We keep forgetting. Yeah.
Actually, everybody likes stories, Jean. So could you tell us your glucose story?
My story. Yeah, well, I grew up in a typical, born 1965, there you can work my age out. And a typical, working class house where my mum cooked all of her food from scratch. She was fantastic, a great cook, but unlimited supplies of sugar. I used to get my dinner money for school, and I used to stop at the garage just down the road, and I would buy 100 Detective Cheroot cigarette, these sweetie cigarettes. That would be my lunch. My mum and dad didn't know. They would have gone crazy. But actually what happened was that I had that start very, very young, this real sugar addiction. And I was known, you know, a funny part of it's not really that funny, but, you know, I used to go to church, and we always went up with our handbags and our Bibles. Well, I used to carry my Bible because my handbag was full to the top of sweeties. And everybody knew me as the person who, if you wanted a sweetie, go see Jean. And so I absolutely lived on sugar, and I used to suffer from horrific mood swings and hormone issues. It got to the point with me that I can remember I became addicted to Coca-Cola. And Coca-Cola is one of the most dangerous, I mean, it should be banned. And I can remember one morning thinking, oh dear, this is bad, when I woke up and I had a 2-litre bottle of Coke at the side of my bed. And before I even got out of bed, I had to drink my Coke to get me out of bed. And it was pretty bad. It was really awful. And in between, I would eat really good food. And then I became ill. I got quite ill because I had to use antibiotics for a long period of time for chronic tonsillitis. And I ended up quite ill at the end of it. And I saw a nutritionist who instantly recognized, she sent me to a herbalist as well. She instantly recognized what was going on. And I went on a complete sugar-free, yeast-free, complete, almost, you know, refined carb-free diet, very, very strictly. And I stuck to that for about 9 months. But within 6 weeks, well, the first 2 weeks, I thought I was having a brain hemorrhage. My headache was so severe, so severe. And then within 6 weeks, it was like somebody had just opened the curtains and switched the lights on. And I could think clearly. My mood completely stabilized, my hormones completely stabilized, and it was absolutely down to sugar. And I had never ever correlated the mood swings, the highs, the lows, the energy crashes with what I was eating. But it was really, really dramatic. Yeah, so
It's interesting. I'm going to pick out one little point you said there. They put you on a yeast-free diet.
yeah.
Why was that?
Because candidiasis, you know, sugar feeds a specific type of gut bacteria, and that bacteria in our gut wants fed, absolutely wants fed, and so the sugar's feeding the yeast, which was causing the dysbiosis in the gut. And it will drive, you know, the gut will drive your behaviors without a doubt. They always say, what is it, who's driving the car? Is it you, or is it the
Yeah, that's
10 trillion bacteria that's living on you and in you?
yeah, it's very interesting. So we know that you know, eating a lot of sugar can lead to dysbiosis, the wrong kind of bacteria, but also the growth of yeast in the gut. We do know that the yeast is able to signal to you that it needs more sugar.
Yep.
So, you know, there's pretty good evidence that a lot of sugar cravings really come from having an overgrowth of this type of yeast in the gut. And then we know that the byproducts of the yeast actually cause hormonal dysregulation. So, you know, the toxins produced by the yeast can create a lot of damage within the body. So, yes, very, very interesting connection there with sugar and yeast infections. So,
and it is interesting because I always feel that it was a pretty bad point in my life. However, I now know how to get out of it and how to regulate it. And I think the thing is that I feel like I can really understand and empathize with my patients who really struggle to stop sugar. And I understand how difficult it is. And I always say to people, look, you know, you potentially are going to feel quite ill for a couple of weeks if you just stop dead. There are ways to do it more gradually. I'm an all or nothing kind of person. I was told to stop, and so I stopped. But I wouldn't necessarily recommend that for someone who is maybe in a in a job that they need to be able to not think they're having a brain hemorrhage.
So I mean, what are some tips for people who, you know, either for people who know they're having too much sugar, or for people who maybe are not quite aware of how much carbohydrates or sugar there is in the diet? What are the things you can do to just reduce the roller coaster of blood glucose?
For me, it was protein. absolutely, without a doubt, it was protein. It was starting my day with protein. And how you start your day will determine how the rest of the day goes.
Right.
And we in Scotland, we're always told porridge for breakfast is wonderful. Porridge, if you've ever worn a continuous glucose monitor, which I wear regularly to keep myself in check, porridge spikes you like nothing on earth. It 40 minutes after eating porridge, I'm ravenous. And when I saw it on the blood glucose monitor, it took me as high as white rice did. It's a spiker of your blood sugar levels. I started my day with protein, and I think in this country, we need to get out of the habit of thinking that breakfast is always about cereal or about bread. If you go to Malaysia or you go to Thailand or you go to some of these countries, they will have curry for breakfast.
Yeah.
And so I would eat things like avocado and salmon and things like that for my breakfast. What I would eat for my dinner, I would eat for my breakfast. And that stabilized me.
It's interesting what you say about how you start your day, because if you think about it, if you start your day with a carbohydrate, then your blood sugar will rise and it'll fall very quickly once that insulin comes in, and then you feel you need something more, and then so you start off like that, you're going to be on that daily roller coaster. Whereas if you start off with protein, you're kind of stabilizing, and then you're not going to go on that roller coaster. So I'm also a big believer that your breakfast should be protein based. There are some other hacks as well, I think, that can be helpful. Little things like the order in which you eat your food.
Yep. Yes, making sure that you eat your protein to begin with, and then your vegetables, and then add in your carbohydrate if you're having them. I always think of it like a bowl like this. If you think of your stomach in that shape, and the part where your food goes down into the duodenum is right at the bottom, and think of layering your food into this pot, the slowest release first. So if you think of a pot and think you want to put protein in first, then your vegetables, and then your carbohydrate, and then it will go through slowly. And it will. It's a very simplistic way of thinking of it, but it's a nice visual way for me. So eating in that order. Another great thing is to have. They used to have crudities before breakfast, before food. So having some raw food or a side salad and eating that first, that will break down slowly, and will slow the release.
Yeah.
Yeah.
But yeah, I think in terms of brain health, blood glucose is incredibly important. I'm going to encourage everyone out there, if you haven't done it, to measure your blood insulin levels as a really early indicator of whether there may be, your blood glucose is being dysregulated, especially if you have mood swings, hormonal dysregulation, brain fog. What else am I missing, Eugene?
Energy slumps.
Energy slumps.
That classic at 3 o'clock in the afternoon, and it's, what did they call it? It was one of those adverts that did it really well. It was like Coca-Cola time, or where have your lunch.
A lot of the sugar advertisers use that kind of afternoon slump that people have. So they use that afternoon slump to encourage people to go and get some sugar, which is the worst thing they can do.
What I always say to people is that one of the ways to know whether or not what you're eating is spiking your blood sugar levels is, how do you feel after your lunch? When you eat your lunch, do you then feel you could sleep? Because if you get that slump afterwards, about 45 minutes later, you think, oh, golly, I could just shut my eyes, which a lot of people get. You know that your carbohydrate content your refined carbohydrate content has been too high. And I always say to people, get rid of your sandwiches. Whatever's on your sandwich, have that for lunch with a side salad, or a slow release grain. But getting up, you said it earlier, I have patients who will have toast for breakfast, sandwich for lunch, pasta for dinner. That is just a day of spiking and crashing, and you will end up type 2 diabetic with that lifestyle.
And on that cheerful note,
I know. Just remember, there's lots that you can do. There's tons you can do. And the other thing I would say is type 2 diabetes is absolutely preventable.
Oh, actually, It is preventable, but I think it's also worth saying that it's reversible.
Yes, that's what I mean. Yeah, that's what I meant.
Yeah, it is completely preventable, but it is also reversible. And I think that's a really, really important point, but that if you do get a diagnosis of pre-diabetes or diabetes, it doesn't mean that that's you for life, or, you know, you're on that journey that's progressive. You can halt it and you can reverse it. So I've seen a lot of my patients reverse their HbA1c blood marker back into the normal range.
Yeah. Superb. There you go.
Yeah.
That's a bit more, that's a bit more of a happy ending.
So have a wonderful day.
Yep. Bye.
Bye.